Hello everyone and welcome to today's lecture on deliriants. Deliriants are the poisons acting on brain and inducing delirium, that is acute confusional state with disorientation, delusions and hallucinations. Examples are Datura, Atropa belladonna, Hyoscyamus niger, cannabis and cocaine. Datura, it's from Sanskrit dhurt, meaning cheat, is a flowering plant belonging to family Solanaceae. Other names are Jimson weed, thorn apple, devil's weed and angel's trumpet. Datura may have originated in Central America, but botanists remain unsure of its exact origin. Its hypnotic and hallucinogenic properties are well known since early times. In Colombia, when a rich slave owner died, it was customary to bury his widow and slaves alive along with his dead body. Datura extract was often administered to prepare them for live burial. Its trance-like state, often called as an enlightened state, is used by tribals in several sacred and religious ceremonies. So this Datura is a small shrub with a strong and rather unpleasant smell which grows wild all over the Indian countryside. It grows to a height of 3 to 5 feet and has foliage of dark green, ovate, pointed leaves and large tubular, that is trumpet-shaped flowers, which may be white in case of Datura alba or purple in case of Datura niger. Flowers are bell-shaped and have 5 petals, which open after dusk and close by mid-morning the next day, as Datura is a nocturnal plant. They exude a pleasant narcotic scent, especially at night. If we talk about fruits, they are spherical and have sharp spines which give rise to the plant's English name, that is thorn apple. It contains 50 to 100 dark brown reniform, that is kidney-shaped seeds. They look very much like chili seeds. Now, differentiating features between Datura seeds and chili seeds. If we talk about size, Datura seeds are large and thick, while chili seeds are small and thin. Datura seeds are kidney-shaped, while chili seeds are rounded. Datura seeds color is dark yellow-brown, but in case of chili seeds, it's pale yellow. In Datura seeds, we have numerous small depressions, while the surface of chili seed is smooth. Chili seeds are pungent, while Datura seeds are odorless. If we talk about taste, Datura seeds are bitter, while chili seeds are pungent. These are the seeds of Datura and chili. Coming to toxic principles. So there are 3 toxic principles in case of Datura. We have first one scopolamine, then second one atropine. It was earlier known as Daturine, and hyoscyamus, which was earlier known as duboisine. So these 3 together are known as belladonna alkaloids. Now coming to fatal dose. So fatal dose in case of atropine or hyoscyamus is 10 to 100 milligram. It's 30 milligram in case of scopolamine. And if we talk about seeds, then 50 to 100 Datura seeds are fatal. Fatal period is 24 hours. If we talk about toxic parts, so all parts are toxic, especially seeds. Fruit and nectar, that's honey, is also toxic. Mode of action. Belladonna alkaloids competitively inhibit the muscarinic effects of acetylcholine. The site of action is the autonomic effectors innervated by postganglionic cholinergic nerves or on smooth muscles that do not contain cholinergic innervation. The central nervous system effects result from their central anti-muscarinic actions, that is vagal stimulation and decrease in heart rate. Clinical features. So, these symptoms or signs can be due to two mechanisms, either due to contact or ingestion. If we talk about contact with leaves or flowers, there will be dermatitis in sensitive persons. In case of ingestion, the appearance of symptoms is as follows. In case of ingestion of seeds, the symptoms appears within 30 minutes. While in case of decoction of seeds, it's within 5 minutes. And lastly, in case of ingestion of alkaloids, symptoms appear within few seconds. So all these things results in the appearance of anticholinergic toxidrome. So initially, there will be bitter taste, vomiting, burning pain in the stomach. So these clinical features are summarized in the classic phrase: blind as a bat, hot as a hair, dry as a bone, red as a beetroot, and mad as a wet hen. The important manifestations can be better remembered as a series of Ds, that is, dryness of mouth, slurred speech, dysphagia, dilated pupils with no reaction to light or accommodation, dry hot skin with flushing and hyperpyrexia, drunken gait, that is ataxia, hyperreflexia, convulsions. Then we have delirium with hallucinations, agitation, amnesia, incoherence. In this case, patient is restless and makes purposeless movements. Example, pulling imaginary threads, threading imaginary needles, picking at bed clothes. That is known as carphologia or flocculation. Then we have dysuria, urinary retention, bladder distension. And lastly, death, which is preceded by tachycardia, arrhythmias, coma, and respiratory depression. Now, dose-related progression of symptoms. So, at 0.5 milligram of dose, there will be, first of all, dry mouth. As the dose increased to 1 mg, then there will be dilatation of pupils, blurring of vision, and diplopia. At 2 to 4 milligram, there will be increased cardiac and respiratory activity, and BP will be elevated. At the dose of 5 milligram, there will be elevation of temperature, inability to swallow, and urine retention. And lastly, at the dose 10 milligram or more, there will be clouded sensorium, disorientation, hallucinations, delirium, and coma. Diagnosis. Even minute traces of atropine in blood as low as 10 nanogram per ml can be detected by GCMS, that is gas chromatography mass spectrometry. Secondly, neutrophil leukocytosis is often encountered. Thirdly, dilated pupils. If the pupils do not constrict within 15 to 30 minutes after instillation of 2 to 3 drops of 1% pilocarpine, it is indicative of atropine or anticholinergic poison. And lastly, there is cat's eye test. In this, there is instillation of a few drops of the patient's urine into the eye of a cat, which results in rapid mydriasis. Treatment. First of all, shift the patient to a quiet and dark environment. Monitor and correct the vitals. Then respiratory assistance. If seen late, patient may be in respiratory failure. So in that case, endotracheal intubation, assisted ventilation may be necessary. Then decontamination, and it is done by emetics and gastric lavage with a weak solution of tannic acid. Then the antidote of choice in this case is physostigmine. This physostigmine is a tertiary amine that easily passes blood-brain barrier and reverses central effects too. Its dosage in adults is 2 mg IV slowly, repeated if required in 20 to 60 minutes, and for pediatric, its dose is 0.5 mg IV slowly, repeated if required in 5 minutes up to a maximum dose of 2 mg. Now, why we are not using neostigmine, pilocarpine and pyridostigmine? Because they do not pass blood-brain barrier, because they are quaternary amines. So, central effects are not countered. After that, we can administer IV fluids, keeping a close watch on intake and output and renal function. Agitation can be controlled with judicious use of diazepam. Do not use phenothiazines or antihistamines, since they can aggravate the anticholinergic effects. Lastly, hyperthermia can be managed by hydration and cooling measures. Autopsy findings. So, in case of Datura poisoning, there will be signs of asphyxia. The gastrointestinal tract, that is stomach, intestine, their wall will show inflammation. The seeds or fragments of Datura may be found in stomach, as these seeds resist putrefaction for a long time. And lastly, there will be presence of pulmonary edema. Coming to medico-legal importance, suicide and homicide is rare in this case. If we talk about accidental poisoning, it may occur in children who eat its fruits by mistake, or when used as a medicine, or after instillation as eye drops, or over-enthusiastic use of atropine as an antidote for organophosphate or carbamate poisoning. Next medico-legal importance is corn picker's pupil. Cornfields are usually infested with Datura plants. Harvesting of corn invariably exposes the corn pickers to Datura dust. This results in persistent mydriasis, that is known as corn picker's pupil. A similar condition is gardener's mydriasis, where gardeners dealing with Datura plants growing as a hobby in gardens get persistent mydriasis. Next one is autumnal high. If youths are seen with hallucinogenic symptoms during autumn months, it could be a case of Datura poisoning. Seeds of Datura appear around autumn, and youth may consume its seeds for their mild hallucinogenic effects. Now, if we talk about criminal responsibility, if Datura is administered to a victim without his knowledge, as for stupefying him before robbery, he is not responsible for any criminal act done under its influence. That's come under section 85 of Indian Penal Code. If the person took Datura himself, as for example, as a drug of abuse, he is responsible for his criminal actions. Next, MLI or the medico-legal importance is toxic honey. If during their nectar collecting activity, bees collect nectar from Datura plants. The honey may become contaminated with Datura alkaloids. This may give rise to unintentional poisoning. Lastly, Datura seeds are used as stupefying agent to rob people. Robbers usually mix the Datura seed with food or drinks and offer to travelers in train. Once the passengers are stupefied, they rob them. Thus, Datura gains popularity as railroad poison. Now, coming to the next delirium, that is Atropa belladonna. It is also known as belladonna or devil's berries, death cherries, deadly nightshade. It is a perennial herbaceous plant of the family Solanaceae. The plant has reddish purple flowers. The word Atropa comes from the name of a Greek goddess Atropos, who ended the life of each mortal by cutting their thread with her shears. It refers to the deadliness of the plant. Italian women once used the flowers as a cosmetic to redden their lips and cheeks. They also instilled its extract into their eyes to dilate their pupils to make them appear more beautiful. Hence the name belladonna, which means beautiful woman in Italian. Toxic principles. So it has three toxic principles. One is hyoscyamin, second is atropine, and third is scopolamine. So hyoscyamin is 82 to 97%. Atropine is 3 to 15%, while scopolamine is 25%. If we talk about its clinical features, treatment, and autopsy findings, then they are same as that of Datura. Coming to the medico-legal importance, so it is used as an arrow poison and of course as homicide. The ancient Arabs used it as a poison. The wife of Emperor Augustus and the wife of Claudius both used it to murder their enemies. Now, the next deliriant is Hyoscyamus niger, also known as Henbane. It also belongs to the family Solanaceae. The dried and fresh leaves, flowering tops, and flowers of Hyoscyamus niger are used in folk medicine for intestinal colic, insomnia, bronchial asthma, and motion sickness. Toxic principles are same as Atropa, that is hyoscyamin, atropine, and scopolamine. And if we talk about the clinical features, treatment, and autopsy findings, again, they are same as that of Datura. Now coming to medico-legal importance of Hyoscyamus niger. So this is added to beer. So they have been used to fortify beer since time immemorial in order to potentiate the effect of the alcohol. And homicide. Crippen, an American homeopath living in London, killed his wife with scopolamine, traditionally extracted from henbane. Thank you.